We will be happy to take your questions via the chat room. Please identify. We'll only answer questions if we've identified who the reporter is with, what media outlet you are with. So at this time, I am going to throw it to Dr. Dobbs for his comments. Dr. Dobbs?
Hey, good afternoon, and thank you all for joining us. We'll go over several things. We'll talk a little bit about the state of COVID in Mississippi, and then we'll do a lot of conversation about vaccine. Certainly, we've had a lot of exciting developments and looking forward to this next phase of the response. Of course, you all know that we're seeing ongoing heavy case burdens, many cases, rising deaths, and increasing strain on our healthcare system. Once again, we're at the peak utilization of our hospital beds. We haven't peaked out on ICU capacity compared to over the summer, but we're seeing increasing strains. And based on the number of cases we've had over the past week or so, we know that a large percentage of those are going to require hospital care. We also know that many Mississippians are going to need health care and hospitalizations for non-COVID related issues. And many of those beds are not going to be available. So we'll continue to push our proven and effective methods for preventing COVID transmission, which is simple stuff. It's avoiding social gatherings, it's wearing a mask in public. And right now we're really asking Mississippians to avoid any non-essential social gathering. If there's anything you need to do that's of a social nature, please keep it within your household members and your nuclear family. With that, I will give it to Dr. Byers, who will do an overview of the COVID situation in Mississippi. Thanks.
Thanks, Dr. Dobbs. So today we're reporting out an additional 1,732 cases and an additional 56 deaths. And when you look at those deaths, those are recent deaths. The majority of those have been since November 24th. So these are not older deaths that we're counting. And I think if you look at the situation now with the increased numbers of cases that we're seeing in the state, we are above, as far as case counts are concerned, the peak that we had over the summer months. We are starting to see some increases in deaths as well now. And we anticipate that in the next few weeks that those deaths are only going to increase as we increase the case numbers. We're also continuing to see an impact on our long-term care facilities, and we continue to have outbreaks and deaths occurring in those facilities as well. When we look at the transmission, certainly we are seeing broad transmission in all counties, and we're seeing increases in a number of counties. In many places, we're seeing sustained increases over a number of weeks. And so this continues to be concerning, despite our best efforts to let everybody know what are the best things that you need to be doing to prevent transmission. We're still seeing a whole lot of cases in the state. With the upcoming holidays, certainly there's a potential that we're going to see additional cases moving forward with even higher case totals on a daily basis. So yes, the systems are getting overwhelmed, and the number of deaths that were reported out today is staggering. And I think that's it for me, Dr. Dobbs.
Thank you, Dr. Byers. And so one of the things I wanted to just mention to you all a little bit right now is the vaccine and what we know about available vaccines right now. We're very excited about being on the cusp of access to the Pfizer COVID vaccine. And additional data has been made available today that shows us more details on the efficacy, the safety profile, and how it performs within different age groups and different strata of the study groups. So the phase 3 study data that we have available from Pfizer right now of 44,000 folks, right? That's a lot of people that were studied, shows a really encouraging efficacy of 95%. If you look at the details more and see how does that play out, it shows broad success and effectiveness regardless of age. So even if you're over 65 or even over 70, the efficacy looks really strong. If we also look in the other populations, it seems to be strong male or female, which is not surprising. We also see similar efficacy for African Americans or Caucasians or other sort of ethnic groups. So it looks like it has broad efficacy, at least for the period of time, that we've observed since folks got it. Another thing that was very interesting is it looked like that after 7 days, if even for those who only had one dose, you had about an 82% efficacy. So we know this is a 2-dose vaccine. We really need folks to get both vaccines to have maximal protection, but it does show that this approach to a vaccine for COVID is really encouraging. And then if we switch over to the side effect profile, it was good in that there were no significant adverse safety events, that were sort of like that would result in discontinuation or concern about the trial. There were no mortality events or anything of that nature that were concerning. Now, what they did see, which is not surprising, is some inflammatory side effects, right? So we are giving someone a vaccine. We are putting something in their body that we want to use to generate an immune response. And part of that is going to generate inflammation, which is not surprising. So after the second dose, the majority of people did have some injection site swelling and some discomfort, not surprising. A good number, many, had a transient experience of fatigue, chills, some body aches, again, not entirely surprising. This is short-lived. And then a minority of folks actually had measurable fever, again, transient and short-lived, but not outside of what we would expect, similar to other vaccines that we use frequently, such as the pneumonia shot or the shingles vaccine. So the safety profile looks very strong based on this data. So we're feeling increasingly confident that this is a vaccine that not only is going to be effective and to help protect those who are at the front lines, those who are most vulnerable, but also help us start to get a lid on this coronavirus pandemic that's been plaguing us for so many months. And with that, I will go ahead and turn it back over to Dr. Byers, who will give you a brief overview of our vaccine distribution plan over the first several weeks. This is a very fluid situation. We don't have as much information on dosing availability past this short time window, but we are very excited to launch this first phase of the Mississippi COVID vaccine effort.
Thanks, Dr. Dobbs. So I know that many of you have seen the newest ACIP recommendations for those folks who should be vaccinated first. And if you've looked at it, it's healthcare workers and those residents in long-term care facilities. Now, we expect our initial allocation to come probably around December 13th, certainly sometime in the next week or so. And it's going to be the Pfizer vaccine, and it looks like it's going to be a relatively limited number of doses. We have an anticipation of about 25,000 doses. So our primary first goal with this initial round of vaccine that we're going to get is to make sure that we make that vaccine available to healthcare systems and hospitals for them to be able to vaccinate those high priority frontline healthcare workers, especially the ones who are taken care of and have a potential to be exposed to individuals who are infected with COVID-19. So that's going to be the first big push. And, we hope to make allocations available throughout all hospitals and healthcare systems in the state with that first round. So that's week number one. In the second week of this, we anticipate that we are going to receive some additional Pfizer vaccine, potentially some Moderna vaccine. We don't have exact numbers on what the allocation is going to be at this point. As Dr. Dobbs indicated, it is very fluid. But in that second week, one of our big goals is to begin the allocation process to make sure that we get healthcare workers and residents in long-term care facilities, first the nursing homes, to get them vaccinated. So we'll start that allocation process of vaccines at that point. Additionally, we're going to, and planning is ongoing right now, that we are going to have drive-through vaccination sites at several of our selected county health departments that will be available for healthcare workers, all healthcare workers, any healthcare worker who is not being vaccinated by their healthcare system, to come in and get vaccinated at those clinics. So we're going to roll this out as our primary priorities of healthcare workers and long-term care residents. In the following weeks, as we get those additional allocations, first and foremost, what we want to do is make sure that we continue to vaccinate those healthcare workers, continue to make sure that we get those long-term care residents and staff vaccinated. We don't really have clear ideas of what the future allocations of vaccine are going to be. Again, it's very fluid. We do anticipate receiving some, but certainly a lot of our vaccination efforts and activities are going to be centered around the number of doses we have available to reach that most critical population. And then, obviously, as we move into next year and get more allocations, we'll be working through the priority groups. And often a lot of this is going to be going on at the same time. So, Dr. Dobbs, I think that's pretty much it in a nutshell. I don't know if you had some additional things about that vaccine planning that you wanted to add.
No, I think that's perfect. Thank you, Dr. Byers. And just please know that we have a pretty good, certainly we have a plan going far out. But as far as like awareness of precise dosing of vaccines, we think a pretty good vision of the next couple of weeks. But it's going to be very fluid, and we've got a mechanism to get all this distributed to our priority groups immediately. So I think I'll go ahead and start going to the questions if that's appropriate. And Liz, I'll go ahead and start with Scott Simmons from WAPT, and his question is, how long will it take to get the general public doses? I think these are two different questions, so I'll separate them out. So that's a good question. So after we complete this first phase, we are actually still waiting to get further guidance from CDC, the Advisory Committee on Immunization Practice, on who are the priority groups after healthcare workers and long-term care. We suspect it'll be either or a combination of vulnerable people and essential workers. Now, many of those will be, obviously, it's general public, right? But within a prioritization scheme. But it'll probably be many months before we can have a sufficient amount of vaccine out there for every Mississippi person who wants it. And to get every Mississippian vaccinated, we probably are looking well in into spring, even into the summertime, just to get that many doses available. So it's going to be a relatively measured process to get all that done.
Thomas, why don't you go to Connor? I'm waiting to see who Mr. Shuffman is with. So everyone, please identify what media outlet you are with, and we will take your questions. So let's go to Connor Rayborn, and then when I hear back from Mr. Shuffman.
Well, I've got one more question from Scott. I'm sorry.
Okay. Sure.
He also asked, are we seeing lasting effects from people who recover from COVID? Yes, we are aware of people who are reporting this sort of long hauler syndrome. What we hear a lot, and is not uncommon, is it took me a month, it took me 2 months to get back to normal. And then there's a smaller slice of folks who still are not back to normal because there's still fatigue. We've seen a lot of memory issues. I want to remind everybody that this is not a respiratory virus. This is a whole body virus. Based on how this virus operates, it attacks blood vessels, and blood vessels obviously go everywhere. And in no place are blood vessels more important than your brain. So we are seeing some of that, similar to what's been reported in the rest of the country and around the world. I do see a Mary Carol Sullivan, WCBI. Can you tell me at what point there are plans to relieve stress on rural hospitals which are not equipped for critical care? One hospital in our area is having challenges finding an ICU bed for their sickest patients. Yes, this is a challenge that we're well aware of, and we've been working on it today. We discussed it with the governor yesterday. We have a system of care plan in place that will basically remove some of the variability and the option for accepting patients, and so we have to activate that very soon. We're in the process of meeting with healthcare leaders. There's two pieces of this that I think are very important. One of them is that we need to reserve our healthcare resources as much as we can. And I know that hospitals are restricting electives and making things available, but we've got to make sure people survive the coronavirus pandemic as much as possible. The second piece of it is you know, and part of it does aggravate me. I mean, not from this question, but just you can't clean it up unless you turn off the spigot. And we have refused to turn off the spigot of new cases and new sick folks. And the way to do that is the simple stuff. It's not a joke. If we would just wear a mask in public and avoid non-essential social gatherings, the universe would be an entirely different place. You'd be like, what is this coronavirus thing? Why is everybody so worried about it? But we've just been unable to take those simple steps. So please, once again, want to reiterate how important it is to understand that we've got to turn off the supply. People are going to die and have died because they couldn't get access to the care they need throughout this coronavirus pandemic. And that is going to continue to happen until we turn off the spigot. And I'm glad that we're going to have the vaccine as a tool in that part of it. Sam Huffman from WJTV. The UK began their vaccination today. When can Mississippi expect the first shots to be given? I hope to give the first shots of coronavirus vaccine next week. It's not a promise, but it's a hope. And so, but it's a hope based in some data. So we're looking forward to the possibility of that happening, assuming the EUA and the FDA review and all that goes just fine.
And Dr. Dobbs, you'll be the first one in the state to receive it.
I will.
Have a press conference and you and Dr. Byers can stick out your arms.
And know that we are healthcare providers. I tested somebody for coronavirus today. We do it all the time. So we're practicing what we preach on who's going to get it first. When do we get the Moderna vaccine? How are you working out the logistics of the freezing? We'll do the Moderna vaccine first. It'll probably be a couple of weeks later. We don't have as great a visibility on that, and I would hate to speculate too much, but probably it's about 2 weeks behind the Pfizer. Would you agree, Paul? That's about where it is, 10 days or so?
Sorry, I was muted. Yeah, 1 to 2 weeks behind. And obviously there's a lot that has to go into play. It has to clear that approval process through the FDA before we can start getting it and administering it.
And then the second part of the question is, how are you working out the logistics for the freezing requirements for the Pfizer vaccine? Certainly it's tricky, but we have identified enough, minus 80 type freezers where we can store all we're going to get and more going into the future. So we do have storage locations available. The tricky part is not the storage; it's going to be the timely delivery. Once we have the shippers sort of distributed, we can get them to somewhere, and you have several days where the dry ice will keep it viable, and then after that, once you thaw it out, you only have a short period of time, several days, to get the vaccine into people. And so the big part of it's going to be is once you unfreeze the vaccine, you got to have folks lined up and ready to get vaccinated. And that's the situation with a lot of these hospital systems, which is great, is they've pre-identified people who are their most critical, most exposed sort of folks to go ahead and get it. And so that's actually getting the shots in the arms is the most critical logistic piece to that. But we've got plans and backup plans for our backup plans. Nick Juden from Jackson Free Press. Once an individual receives their second shot of vaccine, is it safe for them to individually return to normal? Can they go out about their day without asymptomatically transmitting the virus? How long would that safety last? 8 months or more? Good question. We don't know. The data that we have on the Pfizer vaccine shows efficacy for illness, and there's really no data on transmission. Now, of course, we could assume, I think with some reasonability, that there's likely to be a correlate between protected from infection and being able to infect someone, but we don't really have data to support that. But the flip side of this is, there are some potential reinfections. We don't know that that's going to be possible. We don't know how long it says 95%, at 2 months or so, but what's it going to be at 6 months? So not sure about that, but we foresee everyone in the country and the world needing to take some simple precautions for months to come. Absolutely. This is Michael Kaplan from CBS National News. how would vaccine distribution over the next few months be impacted without additional federal funding? What's your message to your state reps in Washington? Yeah, we have calculated that to be able to, for the Department of Health folks and the people that we're going to bring on, we would need more than $17 million to pull it off. And we have confidence that, and that's just us, right? So there's a lot that has to go on there. But we have confidence. We've had feedback from our delegation and from other leadership organizations at a federal level that they're going to come through for us. It's critically important. We can't make this happen without support. And if you've seen, in a lot of the media, the developing the vaccine is step one, and step two is getting it to people. If we develop the vaccine but don't get it to people, it doesn't matter that we've done something phenomenal. We can't stop before we get to the finish line. We've got to invest the amount of money it's going to take to make this be successful. So yes, we will continue to message that. This is Anna Snabes from the Meridian Star, 80 long-term care facility resident COVID-19 related deaths have occurred in Lauderdale County during the pandemic, according to the most recent data MSDH has released. Lauderdale County has the second highest number of long-term care deaths in Mississippi counties. What do you attribute the high number of long-term care deaths in the county to? Thanks. To a lot of coronavirus. The coronavirus deaths in nursing homes are very much attributable to how much is going on in the community. You can't separate them. It's a fallacy to even imagine that you can separate a nursing home as a singular sort of citadel to not be impacted from all of the infection that surrounds it. So controlling community infection is an important thing. And especially for Lauderdale County, you guys were hit really hard early on, especially early on when we know that the nursing homes were hit harder, more proportionally than they are now. So, but it's a reflection of the transmission in the community. And I think the fact that y'all got hit so hard with the nursing homes early on. And Dr. Byers, anything you want to add to that?
No, just reiterate what you said. When we see a lot of transmission and a lot of cases in the community, that translates to more cases in the nursing homes, and that's an extraordinarily vulnerable population.
Yeah. So Kobe Vance, MPB, during the summer spike in July, deaths inside nursing homes made up almost 50% of all the state's COVID-related deaths. Currently, those deaths make up around 35%, but with cases surging in the community and long-term care outbreaks rising, do you think these deaths will rise again? If so, how far away are we from this? Yeah, no, absolutely. I think we will continue to see increasing deaths in long-term care. They're not totally insulated from the rest of the population. There are several things, though, that are a little bit different right now. Compared to March and April, we have widely available protective equipment. I think that's helpful. We've had an opportunity to train and work and make sure that the staff are better prepared to prevent. We also have a testing regime that's going to prevent some. Testing is not a perfect measure. It has a lot of holes in it, but it is a tool. So we would hope to prevent as many long-term care deaths as possible. And I think we have more tools, but the best tool is to lower the amount of transmission within the community. And then the second part of your question, also, could you talk further on the struggles facing long-term care facilities right now? What is your messaging to those facilities and administrators running them? Paul, I know you're really intimately associated with these outbreaks. Why don't you answer that if you don't mind?
Yeah, absolutely. So, I think a lot of the struggles that nursing homes and long-term care facilities have been facing is just especially initially, the overwhelming impact that occurred in those long-term care settings. And, we had to catch up and work hard with our infection control and our PPE and make sure that, the long-term care facilities from top to bottom had the tools that they needed to prevent transmission down the road. I think that some of the continued struggles that they faced have been one of the biggest ones that's had a psychological impact on the residents is the difficulty with visitation. I know that a lot of the facilities, and if you remember very early on back in the spring, they were closed to outside visitors. And so that has a significant emotional impact on the residents. You know, a lot of that is loosened up. We have guidance out there now for long-term care facilities to be able to have visitors. I would encourage administrators to continue to stay the course on testing their employees, to continue to identify those employees that may be asymptomatically infected, that we can exclude from the nursing home or the long-term care center before transmission occurs. I would encourage them, if there is an outbreak, to continue to separate out those infected residents from the uninfected residents, continue to do outbreak testing. All of this stuff is important for trying to curtail that outbreak and limit the spread. And lastly, I would encourage administrators in nursing homes and long-term care facilities to look at the visitation guideline to see how they can use those in their facilities to help relieve, especially during the holidays, some of that psychological burden that's occurred with this incredibly vulnerable population.
Thank you, Paul. From Abby Goodnow, can you tell us which hospitals or other sites in Mississippi will receive their very first shipments of Pfizer vaccine? Yeah, that's easy. Every acute care hospital will get some. There will be an allocation to every acute care hospital in Mississippi based on the number of frontline high risk sort of workforce that they've identified to us. It's going to be proportional, right? They're not going to get enough for everybody, but it's going to be a proportional distribution based on how many folks they've identified based on those criteria, that we discussed earlier. So ready to get that out. We will have a few doses, not a few, but a portion of those doses hopefully available by week 2 that we can use through our county health department drive-through and on-site locations to help vaccinate healthcare folks who are not affiliated with a large healthcare system. We want everyone to have equal opportunity to get protected. This is Connor Rayburn from Enterprise Journal. Does 25,000 doses of Pfizer vaccine in the first wave mean enough 2-dose vaccines for 25,000 people, or 25,000 shots enough for 1,200 or 12,500 people? No, it's enough for 50,000 people, actually. There's going to be a first round, so 25,000 people, and another 25,000 doses will be held in reserve before we get it for the second dose for these folks. So yes, it will be actually 25,000 people will want to get vaccinated, hopefully starting next week. All right, Jessica from WMC in Memphis. Can you weigh in on Governor Reeves' Christmas parties plans for the governor's mansion? Are they in accordance with social distancing guidelines, masking, gathering limits, etc.? And will anyone here be in attendance? The last question is the easiest because no, I have not been invited. So, but I can tell you, I'm not a fun party guest right now. I feel like I'm kind of like the Scrooge who killed parties. So I try to avoid. I've been trying to avoid parties for a long time because I'm such so stringent on compliance, right? So trying to practice what we preach. So I don't have any visibility of what activities are planned at the governor's mansion. I know he certainly believes, as we all should, in the value of distance, masking, and keeping our gatherings smaller. If we talk about social gatherings and stuff, we really do emphasize how important that is. But also, for work and school stuff, we know that there are some things that are essential. And I'm sure some of the stuff that he's doing is going to be sort of work related. But if we're careful and we do the masks and the distance and don't eat together, that kind of thing is not eating proximity to one another. It can be done pretty safely. So if the governor, I'm sure he may chat with me about it, but I'll make sure that they have every bit of support they need in specific guidance. Abby Goodnow, could you please update us on your hospital capacity around the state for COVID in patients? You mentioned some weeks back that this was an issue in Jackson, and new numbers just released by HHS showed that other hospitals in towns including Oxford, Brookhaven, Starkville are near overcapacity. What does that look like from your perspective, and what are you doing? It's everywhere. No, it's not just Jackson. It's everywhere. I was talking to Jackson Medcom, who is helping manage patient transfers, and they can't get patients anywhere. They have patients. We're having to send patients from Delta to the Pine Belt. We're having to send folks from the Southwest up to Tupelo. I mean, it's crazy stuff we're having to do. And even on the coast, which isn't quite as overwhelmed as some other places, they are saying that they're unable to take patients, that they're full. So it's pretty much everywhere now, and that's and if there could be a headline somewhere that I could envision, it would say "Not surprised," right? We said this was coming. We knew it was coming. We've been seeing it's coming. It's like we're sitting on the railroad tracks watching the train come at us slowly, and we say it's coming, and the train's starting to hit us. So got to turn off that spigot, but we'll twist every knob and squeeze every bit of juice out of this thing we can. But healthcare is an inexhaustible resource, and people are going to die because they will not have access to that resource. It's just inevitable at this moment. From Kingfish, do you worry the use of antibodies instead of T cells may limit the duration of the Pfizer vaccine? And I'm not sure if he's talking about the balance between B cell and T cell immunity, but if you look at the if you look at the data, immunological data on the Pfizer vaccine, it has pretty good B cell and T cell, and these are things that work in concert. Usually, if we look at a natural infection, then you're going to have these work together. T cells support B cells, and T cells also kind of do their own thing too. So I'm actually encouraged that it's going to have a good balanced immune response based on the mechanism of action. These messenger RNA vaccines, basically, which are administered in these little microscopic balls of fat, so they can get in your body, like a little storage shell, actually train your cells to produce the spike protein in a way that mimics the way they would look if you were infected. So that's very encouraging from an immunological perspective, that it's going to mimic infection just enough to give you a pretty robust immunity. So I would speculate that that's one of the reasons why we're seeing such this sort of 95% number. It's very encouraging. Lee Willingham from Associated Press. What is the current situation with churches and coronavirus outbreaks in Mississippi? Now that we are a couple of weeks into the surge, where do churches rank for you on your list of social gatherings where the most spread is occurring right now? In your opinion, is it possible to do safe in-person church right now? So let me do a parallel sort of answer. I think one of the most high-risk things you can do right now is go to a funeral. We're seeing funerals lead to funeral on a regular basis. So, those are scenarios where there's emotion, there's physical contact, that sort of thing. So certainly, I think that's one of the gatherings that I think we need to be very careful about, and would keep it small, keep it to the close family, separated and outdoors as much as possible. Is it safe to do in-person church? There are safer ways to do it. The safest thing to do and the smartest thing to do is just at this moment is to go virtual and not have in-person services. We've seen a lot of outbreaks, and we've seen that it's really hard to maintain discipline in these settings. Singing, which is one of the best ways to spread coronavirus, is something we do a lot. People see people they love. People see people they know. And so one of the fallacies that we've seen over and over again is that you won't get infected from somebody you know. It must be something deep baked into the back of our brain from when we were hunter-gatherers, that if I know you, we're safe, right? And I can let my guard down. But it's quite the opposite. If I know you, you're going to be more likely to give me coronavirus than a stranger. That's where we're seeing people catch coronavirus from people they know. And so it's important to prioritize virtual church right now. But whenever it is a better idea, I've heard of protocols or strict separation, strict masking, and really not singing amongst those who are in worship services is an important thing to do. So there are ways to do it safer, but the safest thing to do right now is to have virtual services. Okay, follow up on Leah's question. I asked a while ago what the progress on communicating with Mississippi's religious organizations and churches was, going convincing them to have distant services. Here in the worst phase of the pandemic so far, how is that progressing? Is the governor's office participating in this effort? You know, when we made the recommendations last week in an official guidance statement, we've had really good feedback from our faith leaders. So that's been great. Um, uh, uh, we know it's a hard thing to do, but we know that the pastors and the leaders of other faith traditions also love their congregants. So um, I think it's been pretty good. We have engaged through our health equity group, and also I did a Zoom call with several health leaders last week, and we'll continue to do that to try to communicate how important that is. And we also have some other communications we're going to do, making sure people know what the safest options are. So I think it's going okay. I know it's hard, but we want to bring as many people across the finish line as we can. I had mentioned previously that I think there's a good chance that 1,000 people more can die between now and 2021, and those are people we can save. There's people who are going to be after that we can save, and we got a vaccine on the horizon. Now's the time just to maintain patience going forward. And certainly, we've been talking to the governor's office about this, and I think his own church has moved to virtual, and certainly he's supportive of our messaging. This is Abby Goodnow at the New York Times. Can you tell us which hospitals or other sites in Mississippi will receive the first vaccine? I think we said that before.
Yeah, I think we answered this, Thomas.
Could you please update us on your hospital capacity around the state for COVID and other patients? We have very limited capacity. We have essentially no hospitals that are routinely able to take ICU transfers. You know, if they're showing up, what we see is we're managing a lot of ICU patients in the ER until we can get a bed. Oh yeah, this is what we did do this before. But anyway, it's the same thing. So sorry about that. Bracy Harris with NBC. Are there concerns about smaller rural hospitals being unable to provide the Pfizer vaccine on-site due to limited resources? How will frontline workers such as hospitals gain access to the vaccine? Yeah, you know, our rural hospitals, small hospitals are super capable of doing a lot of great stuff, and we're going to send them vaccine. Now, what we're going to have to do is we're going to have to allocate it. We're going to take on a lot of the dirty work of trying to break it down from the complicated cold chain stuff into allotments that they can use, and we'll package it in a way that gives them time to help it unthaw. And then once they do, they'll be ready to, thaw it out, and over the next few days, give it to people they need to give to. So I think we do have a good plan to make sure it's available to rural hospitals. But in addition, this is one of the reasons why we want to do our county drive-through and county clinic vaccine locations, so that healthcare workers who might not be able to get it through a larger health system will have that mechanism to get vaccinated as well. From WDAM, Melissa Rademacher. Thank goodness for vaccines, but what is the health department's plan for getting information to people who are skeptical of the first doses of vaccines? How many people or percent of the population has to opt in to get the vaccine to achieve effective herd immunity? Yeah, so obviously it's something we've been thinking about a lot. We've been meeting with leaders of different communities throughout the state, whether it's going to be faith leaders or political leaders or African American community leaders, Choctaw folks, everyone we can to kind of get a foundational understanding about what we're talking about. We haven't pushed the safety message yet or the efficacy message yet because we haven't had the data, and we didn't want to be premature, and obviously we didn't feel that we could say it. I think as the EUA becomes available and as we're getting more data, we can be more forceful in our messaging. We're already looking at a communication strategy to make sure that whatever data is available, right? So we can't put our messages out until we know what the data is. We can do it aggressively, social media, et cetera, and also working closely with our partners. So we will try to communicate clearly with that. And also we'll depend upon our partners to help share the message. But I think, put your money where your mouth is sort of situations is important. And I think that that I myself and Dr. Byers and other leaders in the health world in Mississippi will get the vaccine first, to show that we believe in it and that it's the right thing to do. There's not an official EUA yet, so more data may be forthcoming, but based on the data that I've seen so far, I feel really good about it. Jessica from WFC.
There was a herd immunity question.
Oh, sorry, I missed it. Oh yeah, the herd immunity. Probably 70%. I mean, it's a pretty simple calculation. It's if you look at the R0 value, you can calculate what the herd immunity threshold needs to be, and based on an R0 value of 3, which makes sense for coronavirus, it's really going to be about 70%. So we'll see what happens in real life, but if you need an estimate, I think that's a floor that we need. I mean, certainly if we have 50% of folks, we're going to have a lot more benefit. It's going to impede transmission, but to really get a pure herd immunity effect, we're going to need more than 50% for sure. Okay, that was the Reeves one again. So there's some echo in here. Sorry. This is Susie Kim from NBC News. I understand that phase 1A is expected to require 200,000 doses of vaccine, and around 225,000 doses are expected in its first shipment from Pfizer. Do you have a rough time frame for when you expect to receive the other 175,000 doses required for the completion of 1A? We don't really. We've been given some sort of estimates that we would get a substantial number, cutting that deficit by a considerable amount before the end of 2020. But just to kind of ballpark it, I think it's going to take us through January to get through phase 1A. Paul, would you think that's a reasonable estimate?
I agree. We have been given some estimates of potential vaccine allocations, but we're kind of in that wait and see mode to see what comes down the line on that. But I think that your estimates for how much that it would require for healthcare providers in that first round is pretty close.
And so from Kobe Vance, it has been nearly 2 months since you warned that more white Mississippians were being impacted by the virus than other race demographics. In August, white residents made up around 43% of deaths. Now they make up 49.9% of all coronavirus-related deaths. Could you discuss this trend and any other demographics that you are concerned about right now? Yeah, no, that's something we're still seeing. We're seeing it's odd. We're seeing a disproportionate impact on white Mississippians, and that is entirely related to behavior. There's just no way around it. We've had a lot better buy-in from Black leadership and Black communities. There's a lot of reasons why that may be the case. There may be a lot of reasons. I mean, we still hear crackpot nonsense from folks who are discouraging people from doing simple, safe, and effective things that will protect them and their families. Hopefully, some of that's starting to fade now, and I think that it's just what it is, and we need everybody, white, Black, whatever, to follow the simple steps so that they can not only get through this unscathed, but bring their family and vulnerable family members with them to the end. See, do you recommend abolishing the certificate of need laws to increase hospital capacity in Mississippi over the long term? Yeah, that's a great question. CON is a challenging thing. So certificate of need is rules about who can build a hospital and that sort of thing. I'll tell you just as a foundational statement, the Department of Health is agnostic in administering the CON rules, right? It's a legislative mandate that we have, and we'll do it. And if the legislative mandate changes, if it goes away, then we'll comply with that. But healthcare is a complicated thing, and if you got rid of CON, you know what would happen? There would be a lot of places taking care of rich folks and fewer places taking care of poor folks. And so there's no simple fix to health disparities, and CON going away would not fix healthcare disparities under any circumstances. So I think that's a different conversation, but I don't think it would help our hospital capacity issues because people don't want CON to build hospitals for ICU care. You could add a bunch of ICU beds now with no problem. There's no CON restrictions on ICU beds, but we'd see a lot more ambulatory surgery centers, no doubt.
And we don't have the staffing for all of those additional ICU beds either.
We don't. Are you and Dr. Byers serious? From Anita Lee. Are you and Dr. Byers serious about getting the first vaccines live during a news conference, or did I hear that wrong? Amen. We will. Yeah, we will. As soon as we get it, we will show you. We practice what we preach, and based on the information I've seen right now, we'll be very comfortable getting vaccinated. Kingfish. One problem with hospital capacity is even when physical facilities are available, staff is lacking. This is a public health emergency. Why have we not activated medical units of the National Guard? We have activated medical units of the National Guard, but they're doing all the testing and our vaccination stuff, so that's where they're working. But they're not. In general, the folks that we've activated are not really that I'm aware of ICU nurses and stuff like that. And a lot of those folks, if you're on National Guard, you're already, and if you're an ICU nurse, you're already working. So it's a resource that's inelastic. It's there, and you can't really change it much. So I don't really think that's a valid option. Again, really, our only option is we'll squeeze more out of the lemon, and there are going to be healthcare workers who are phenomenally exhausted because we collectively have put too much stress on them. It's our fault. We'll do I and other people and healthcare professionals will do everything we can to make sure that we bring as many people across the finish line with us. Any last questions?
Dr. Dobbs, I think Abby has a question there. Why not immunize residents at long-term care facilities first, if that's where you are seeing especially high rates of death?
Yeah, essentially we're going to do it at the same time, right? I mean, we're going to go ahead and get them to the hospitals like week 1 with our limited allocation. But the other thing is we're not going to get enough on the first week to give it to long-term care. So once we have that second amount of vaccine that should be sufficient, we're going to go ahead and get it out to those guys. The other thing is, I think that it's a real endorsement of support for the healthcare community to take the vaccine ourselves. There's a little bit of reticence in the long-term care. I would encourage you to talk to residents and families of residents that they're still a little bit hesitant. And if we don't put ourselves out there first and take the first doses of vaccine and show that we believe in it and we trust it, then I don't think even the long-term care folks are going to have the uptake that they need. So I think there's counterbalancing forces, but essentially, I mean, it's all coming out in that first phase. So if we combine week 1 and 2 as like the first sort of wave, we're in it together.
So Dr. Dobbs?
Yes, ma'am.
It looks to me like we do not have any more questions at this time. We will definitely schedule. We're trying to schedule these as often as we can, so you have a chance to ask your questions. But Anita Lee, you are right. Dr. Dobbs and Dr. Byers will take their shots at a live press conference for all of you to see. So
we're ready.
Thanks for joining us today, everyone, and we'll look forward to talking to you soon. Have a great day.